There is little reported progress in budget negotiations. Health care has not so far been a major issue in the fiscal cliff talks. It may, but Chief National Correspondent Jim Angle tells us tonight, now that President Obama has won re-election and Obamacare kicks in, the economy is about to feel the effects.
Starting January 1st, the Obama administration will raise taxes far more than just eliminating the Bush tax cuts for the top brackets. The new health care law will raise taxes of its own, an additional $318 billion over 10 years, including a new 3.8% tax on investment income, plus many reduced deductions for those of all incomes.
This is not an inconsequential thing that you're imposing such a big tax increase in the midst of a very slow economy.
Those affected most will be small businesses, many of which pay taxes at the individual rate and get a double whammy with the simultaneous end of the Bush tax cuts and tax increases under Obamacare, almost a 60% increase in taxes on investment.
Entrepreneurs with small businesses with a certain number of workers, now they're going to be facing a 4, 5, 10 percentage point increase in their tax liabilities. That means they're just going to have less income to invest in their firms.
For some small businesses, it could be a bit of a hardship. For other small businesses, they're just going to go on doing what they're doing.
In fact, it may be much cheaper for small businesses to pay a $2,000 fine to not offer insurance and let their employees go on the taxpayer-subsidized exchanges instead, which are supposed to be ready in October 2013. Those new Obamacare taxes will be a major source of money for rather generous taxpayer subsidies.
The subsidies are going to be, depending on your income, $10,000, $12,000, $15,000, which is a lot of taxpayer support. Much higher, it's important to understand, than the support that someone gets if they stay in an employer plan today.
And a huge expense for taxpayers. Many businesses are waiting for federal instructions on what they must include in insurance plans, but may have to renew coverage before they get them.
Some of them are going to have renewals in the spring. Some will be in the summer, some in the fall. So the clock is ticking down.
So this is a giant experiment for individuals and small businesses, an experiment in both health care and federal finances, one whose outcome even supporters aren't sure how to predict. Brett?
Jim, thanks.